Ladies and gentlemen, as we come to the end of this morning's conference, we want to look in a very heartfelt way at where we are. We have looked at where we are epidemiologically, in terms of testing, clinical science, treatment, therapy. But we want to get really at what I call the heart and soul of the COVID-19 response. The people or population, we. How do we feel? We talk about things like social distancing and the impact that is having on us. So as we move into Code Red, and as we approach Code Red, we want to look at hope in uncertain times and talk about where we are and what about us. And there's no better person that I know to present this topic. He was a speaker in our first COVID-19 pandemic preparedness conference, and I must say we had a lot of positive feedback on his talk. No other than Professor Wendel Abel. Professor Abel is currently the head of the Department of Community Health and Psychiatry here at the University of the West Indies in Jamaica. He's also a member of the UWI Regional Task Force on COVID-19, and he's professor of mental health, and he's well known in Jamaica and in the region for his work, his public service, and his work in promoting positive mental health. And that's why we have him here this morning, ladies and gentlemen. Let's welcome Professor Wendel Abel to really close us off on this, at this conference here this morning. Welcome, Prof.
Hello, everybody. Today, I'm going to be talking to the topic, hope in uncertain times. It was almost a month ago that we hosted the UWI conference on COVID pandemic. And it's almost 4 weeks later. And I want to pose a question to us. How has your life changed? And wherever you are today, I want you to just quickly write it down. Without thinking, just make a list of the changes that have occurred in your life. You can keep doing it, yes. You have a few seconds left. Okay. And I can only imagine some of the experiences we're sharing and some of the things that either come to your mind or you would have written down would include lockdown, for some persons, unfortunately, job loss, layoff, school closure, children at home, the financial problems, talk of economic recession. Sadly, for some persons, it's about illness and death. Hopefully for most of us, it's about social distancing and just being able to practice it. And for all of us, certainly our social lives have become limited. And the way we work and even the way we worship would have changed. These are indeed uncertain and frightening times. Uncertain and frightening times. But I want us to be positive and to remain positive. And to remind ourselves that although many persons will get COVID-19, it will be in a mild form, hopefully. And I'm sure this would have been shared with us by previous speakers. We also know that social distancing reduces the number of persons getting it at once. And the good news is the majority of persons who get the disease will survive. And I've shared this before, but I just want to share it again, that the death rate, and it's over a range now and it changes, but approximately 99% of persons who get COVID-19 survive. And therein lies the hope, right? Only 1% die, and we hope we're not among the 1%. What about us? And so we encourage us to be positive, stop the catastrophic thinking. And you know, I've been shared it with us before, and to remind ourselves that we're not in this alone. We're all in this together. And you know something? We will all get through this together. And I think that therein lies the consolation and therein lies the hope. But despite my trying to generate hope and being positive, for many persons actually go through an emotional roller coaster, what I refer to as a COVID emotional roller coaster. And for those of us who've been on a roller coaster, we know what the feelings are like, right? And so I want us to name your feelings. I have projected here a list of feelings. And as I go along, check them if you're experiencing these feelings. Many persons, it's fear. Other persons, anxiety. Other persons, disbelief. In fact, sometimes I wake up and I ask myself, was I dreaming? Is this a dream? Is this for real? And I have to come back to the real world and say, yes, this is a pandemic. It's happening in my lifetime. Unbelievable. For some persons, depression. If you're feeling depressed, check that. And for other persons, frustration. As we cope with the lockdown, the fact that we have to be remaining home, we can't socialize as we used to. And a big one for many persons, grief. Because, grieving is a natural response to loss. Be it loss of your job, for persons who've lost family members, loss of a family member, loss of the things that we have been accustomed to doing, yes? Just our daily routine and interacting with people. And so I want us to name our feelings. And if you have any other feelings, just write them down. Because it's important that we deal with these feelings. We have to name them, claim it, and tame it. And I want us to repeat it wherever you are, right? You may be in a room by yourself, and if somebody hears you saying that, they may think you're going mentally ill, right? But just smile about it. So everybody repeat it. We're going to name it, claim it, and tame it. I want to remind us in these times to be compassionate with yourself, right? Remind ourselves that our feelings are normal and natural. And when we have these emotions and we go through this emotional roller coaster, it's not a sign of weakness. We have these feelings because we're human, right? In much the same way, cars run on fuel, human beings run on feelings. So we must name it, claim it, and tame it. I want to encourage us to live now in the present. Let's not think about next week, next year. Focus on the here and now. And you know something? Let us be grateful that we're at a place, we're alive. We can be listening to this discussion. Yes? Let us focus on the here and now. And we have to learn to accept those things over which we have no control and focus on the things that we can control. And to remind ourselves that tough times don't last, but tough people do. Let's repeat that. Affirm it in your consciousness. Tough times don't last, tough people do. I just want to turn to our healthcare providers. And I'm numbered among healthcare providers. We're on the front line, some of us more so than the others, and I want to commend my colleagues who are on the front line. They're exposed to the COVID virus on a daily basis. They leave their homes in the morning, I'm sure thinking about the possibility of illness or even death. They're working long hours. Many of them suffer from burnout, or maybe close to that point. They're away from their family. It must be very difficult for them. And I want us to pause wherever we are at this point in time and applaud them for the fantastic job that they're doing, right? Our healthcare workers, right? And it's important that we also help to protect them by staying home. And so, to our healthcare providers and all of us, I just remind us to ensure self-care, take care of self, ensure we're having adequate rest, we engage in physical activity as best as possible, pay attention to our diet, and manage stress, whatever way you learn to do it, whether through physical activity, through your spirituality, prayer, relaxation techniques, manage stress, especially during these difficult and uncertain times. It's important that we filter the news. News today can be very confusing, sometimes scary, hopeless. I'm sure you find that that's your experience. Certainly it's mine. And what we have to do in these uncertain times, confusing times, is that we have to set limit on television watching, being on the internet or social media time. It's very important. And sometimes it's important for us to decrease the conversation. Somebody calls you. Next time you get the call and somebody wants to talk to you about COVID, tell them you want to take a break from that. You want to think about something positive. Yes? We have to shift the conversation sometimes. And remember, your actions count. Everybody, we must take responsibility for our actions. And I'm not going to go through these. We know the things that we need to do. And I know many of us have been doing a great job here in terms of our hygiene, respiratory etiquette, avoiding close contact, staying home if sick, cleaning objects and surfaces. Very good. And I want us to pat ourselves on our shoulder for the fantastic job that we're doing. Everybody, it's a butterfly hug. Excellent, right? And let us remember our actions count. Let's continue to do that. I want us to remember that it's important in these times of physical distancing to remain connected. And we can do that through whatever way works for us. Telephone, text, social media, chat rooms, Zoom, WhatsApp, etc., right? But let's remember to stay connected. And as we try to stay connected, I want us to pause wherever we are and to sing with me. I can't sing, but I will read the words. We're going to have a sing-along. Reach out and touch somebody's heart, not hands. Make this world a better place. So everybody, reach out and touch somebody's, make this world. If you, excellent, right? Now we're going to sing this along throughout the COVID season, right? Reaching out and just touching somebody's heart and making this world a better place. It will be a better place. We have to remember to cultivate an attitude of gratitude. I want us today to, in a very solemn way, just count your blessings. The fact that you're here, you're celebrating life, we're alive, right? And to remember that gratitude will help us through these times. And as I come to an end, you know, the mobile phone, telephone is a wonderful device. And for it to function, we have to keep it charged so that we can be connected. And I just want to encourage us, just stay charged and be connected. And I want to say to everybody, thank you. Take responsibility for your lives. Therein lies the hope.
Thank you very much, Professor Abel. Very encouraging words from our professor of mental health, and certainly an encouragement for us. Professor Abel, I have a question from a member of our audience who says that I had COVID-19, I was discharged from hospital, I was tested negative, and I'm now fully recovered, but a lot of my family and friends are not as close to me as they used to. I'm now a bit depressed, even though I've recovered from COVID-19. Don't know if you can speak to that person for us.
Thank you for that question. I'm glad and I'm celebrating with you that you're much better today. Yes, and therein lies the hope. Unfortunately, a lot of persons who have tested positive, have become ill, or persons who have been in contact with persons who've tested positive experience some amount of stigma and discrimination, right? And this is born out of fear on the part of other persons. And probably, I mean, just a need for them to protect themselves. And I think we have to recognize that other people, it's not that they want to reject us, it's not that they don't care for us, but they just want to protect themselves. And it's understandable that you would feel depressed. And I probably should have touched on that earlier, that for all of us, but more so persons who have been affected, we're at great risk of longer-term psychiatric problems such as depression, chronic anxiety problems. Other persons may develop post-traumatic stress disorder. It's a possibility, especially for our healthcare workers who are on the front line, working day in, day out. Other persons may even develop conditions such as obsessive compulsive disorder. Know that we have to be washing our hands and going through this routine continuously. For some persons, it may become an obsession, right? And they have difficulty coping with it, yes? So a whole host of psychiatric mental health problems may develop. And you're highlighting the fact that you are getting depressed. Just to remind you that depression is a common disorder, and what you need to do is to reach out to mental health provider, yes, to your mental health provider, so that we can do a proper evaluation and to determine what sort of support you need, whether it's going to be talk therapy or you need to be on medication or whatever, right? But just encourage you to keep faith, keep hope alive. Do the things that work for you, whether it's prayer, relaxation technique, whatever, right? But just to recognize that it's not, depression is a possibility here. And so I'm really thankful that you've shared this with us and really happy to have clarified some issue.
Thanks very much, Prof. We are really prompted and pushed by your talk to leave with hope as we approach Code Red, and depending on where your situation is, all of the issues you raised with the fair and so on, that even as we physical distance, and you said, I think Prof. Scherer said it, that for the elderly, she doesn't like the word social distancing. As we distance ourselves physically and protect ourselves from the virus, we are going to be encouraged, Prof. I'd leave with this to say, reach out and touch somebody's heart and make this world a better place. It's okay to touch the heart at this time. So thank you very much, Professor Wendel Abel. A very able presentation, if I may say so, this morning at our COVID-19 pandemic conference. Thank you.